What if your life suddenly depended on a tiny hormone your body no longer made? What if every meal, every workout, and even every emotion had the power to push your body into danger? This is daily reality for millions of people living with type 1 diabetes, a lifelong autoimmune condition that turns the body against itself, destroying the very cells that produce insulin. Unlike type 2 diabetes, this isn't about lifestyle or diet. Type 1 diabetes often begins in childhood or young adulthood, striking without warning and changing everything. In this video, we'll explore what causes type 1 diabetes, how it is diagnosed, the latest in treatment options like insulin pumps and glucose sensors, and the powerful role of education and emotional support in living well with the condition. Because while this disease is serious, with the right care, life doesn't stop. It just takes a new kind of strength. Type 1 diabetes is a condition caused by a lack of insulin, which is necessary for transporting sugar from the blood into body cells, where it serves as a source of energy. Without insulin, sugar remains in the bloodstream, leading to elevated blood sugar levels, which can be harmful to the entire body and result in various symptoms and complications. This disease is believed to arise from the combination of genetic factors, environmental influences, and the patient's immune system. Specifically, type 1 diabetes occurs when the immune system mistakenly attacks and destroys the beta cells in the pancreas that produce insulin. As a result, it is classified as an autoimmune disease and may be associated with other autoimmune conditions, such as those affecting the thyroid and adrenal glands, certain types of anemia, and vitiligo. The process of developing type 1 diabetes can take months or years before symptoms become apparent. Genetic factors, along with environmental factors like viral infection, is thought to trigger an inappropriate immune response. If a blood relative has a type 1 diabetes, the likelihood of developing the disease is approximately 15%. However, most individuals with type 1 diabetes do not have a first degree relative with the same condition. Typically, patients with type 1 diabetes are not obese, and the disease is most commonly diagnosed before the age of 30, and they require insulin therapy right from the beginning. Initially, symptoms often develop gradually and may include increased thirst, frequent urination, increased appetite, weight loss, fatigue, weakness, blurred vision, and recurrent superficial infections such as vaginitis and fungal skin infections. Sometimes symptoms can develop within just a few weeks. Unfortunately, disease is often detected only after a severe complication called diabetic ketoacidosis occurs, a life-threatening condition caused by very high blood sugar and lack of insulin, leading to acid buildup in the blood. If blood sugar levels are poorly managed, complications may arise after 10 years and can affect various organs. Type 1 diabetes is managed by an endocrinologist. During the initial consultation, the doctor will collect detailed information about the patient's lifestyle, any associated diseases, medications in use, and family history of diabetes. An EKG and basic laboratory tests such as blood counts, markers of inflammation, lipid levels, and blood sugar will also be performed. Patients should prepare for the appointment by noting the names and dosages of their medications or by bringing the medication containers. The diagnosis of diabetes is confirmed through blood sugar measurements, which can be taken while fasting, randomly, or by measuring the glycated hemoglobin, or HbA1c level, which provides information on the average blood sugar level over the past 3 months. fasting blood sugar is measured in the morning after at least 8 hours without any food or drink other than water. A diabetes diagnosis is made if the fasting blood sugar level is 7 millimole per liter or higher. If the random blood sugar level is 11.1 millimole per liter or higher, or if the HbA1c level is 6.5% or higher. Treatment for type 1 diabetes is complex and involves a coordinated approach to diet, physical activity, and insulin therapy. Due to these intricacies of treatment, patients essentially need to learn self-management. They are trained to monitor their own blood sugar, calculate the carbohydrate content of meals, and plan physical activities. The goal of treatment is to regulate blood sugar levels, prevent or delay complications related to diabetes, and enable patients to lead a normal life. The cornerstone of treatment is insulin therapy, which can be administered multiple times a day or continuously using an insulin pump. Typically, rapid-acting insulin is taken with main meals, while long-acting insulin is administered at bedtime. The insulin dosage may need to be adjusted based on the pre-meal blood sugar levels, carbohydrate intake, and planned physical activity. This therapy has been effective and allows patients to manage their own treatment, usually achieving good blood sugar control. An alternative is continuous insulin delivery via an insulin pump. Most of these devices are semi-automatic and require users to calculate the carbohydrate content of their meals. Recently, fully automatic insulin pumps that utilize sensor to continuously measure blood sugar levels and automatically adjust the insulin dosage have become available. However, using an insulin pump does have some drawbacks. Infections can occur at the infusion site, and in rare cases, the pump can malfunction, potentially leading to serious complications like ketoacidosis. All patients are trained to independently measure their blood sugar using test strips, a simple procedure that provides quick and reliable results. This learning process is essential for effective management of their condition. There are sensors that stick to the skin and allow continuous measurement of blood sugar indirectly. If the sugar value falls below a certain level, they sound an alarm and thus warn the patient of the threat of hypoglycemia or low blood sugar. They are not reliable as strips, but they are accurate enough to give an impression of overall sugar control. Regular physical activity facilitates blood sugar control, maintains a healthy body weight, and reduces the likelihood of diabetic complications. At least 30 minutes of moderate physical activity, such as walking or cycling, 5 days a week is recommended. The goal of adequate nutrition for patients is to harmonize food intake with insulin therapy. Patients are trained to count the carbohydrate content of a meal and adjust insulin dose accordingly. This may seem complicated at first, but it is quickly learned. Treatment of type 1 diabetes is lifelong. For this reason, patients are scheduled for regular endocrinologist checkups and are included in various education programs that include education on nutrition, physical activity planning, self-control of blood sugar, and proper food care. The endocrinologist plans long-term treatment, assesses blood sugar controls based on self-measurement by the patient, but also by determining a glycated hemoglobin, HbA1c, corrects insulin therapy if necessary, and schedules examinations aimed at early detection of diabetic complications. For example, patients should see an ophthalmologist or eye doctor at least once a year, undergo laboratory tests annually to monitor kidney function, and have their feet examined 1 or 2 times per year. Also, the value of blood pressure and lipids in the blood is regularly controlled. Psychological support is also included due to the fact that diabetes significantly changes the life of the patient. which leads to greater emotional stress, which, if it persists, can cause behavioral disorders. Affected individuals may become complacent, stop following dietary advice and maintenance of physical activity, and in the worst case, stop using therapy. Eating disorders such as binge eating, bulimia, and anorexia are common. Type 1 diabetes is not just a medical condition, it is a way of life. It demands discipline, resilience, and knowledge. But with the modern insulin therapy, advanced glucose monitoring, and proper education, people with type 1 diabetes can live long, healthy, and fulfilling lives. Managing this condition isn't always easy. There are good days and hard days, but no one has to face it alone. With support from healthcare professionals, family, and the community, the burden becomes lighter and the forward becomes clearer. Remember, having type 1 diabetes means your pancreas stopped making insulin, but it doesn't mean your dreams, your goals, or your future have to stop. With knowledge, care, and courage, lives go on, and it can be just as vibrant, just as full. Thanks for watching. If you find this video useful, consider subscribing for more educational content.